Order, order, and hello and welcome to Reporters Without Orders, a podcast where we talk about what made news, what didn't, and some things that absolutely shouldn't have. We're recording today on the 26th of January, and we're back to recording from our homes because we're in the middle of the third wave of the COVID-19 pandemic. And hopefully, this will be the last wave that we all have to witness or report on. Today with me are Laasya and Supriti. Laasya has joined us just a few months back and she's from Chennai. Supriti, as you all know, is our in-house correspondent and has been reporting with us from Delhi. Before I begin, Laasya, this is your first Reporters Without Orders. I'm going to actually ask you to introduce yourself a little bit, tell us where you're from and what you've been doing before joining Newslaundry.
Thank you. Thank you for having me, Nidhi. It's a pleasure to join you. So, I've joined Newslaundry in September, last week of September, as you all know. Before that, I was working with Citizen Matters and Deccan Chronicle even before that. So I'd been covering more or less Tamil Nadu, politics, corporation, and women and child issues, among many other things I've been covering. And I like reporting and writing. So I'm really looking forward to do stories at Newslaundry.
So what are the kind of things you've been doing for us so far? I mean, it's also quite a lot to imagine one person in the South as if South is one entity, to imagine that, you'd be covering everything in the South, or are you covering specifically only Chennai, or are you focusing on certain beats?
So I got to, in the 4 months, I got to cover, only 2 states. Okay. One is Tamil Nadu and then covered a little bit of Karnataka. And I'm also looking forward to do some stories from Andhra Pradesh. I've pitched a few stories. So the fact that I know both Tamil and Telugu is, I think has come to an advantage. But it doesn't work. Like recently when I was doing a story from Karnataka, I had to actually talk in Kannada. I didn't know and I sought your help. So it's been a learning experience, and it's challenging but exciting too. So
and it's a strange time to join an organization, I'm sure, when you can't be there in person, and so many things have changed in the pandemic, right?
Yeah, so I'm still settling in here, so I'm still understanding the stories we do. And I hadn't covered a lot of politics before joining Newslaundry. So now, when I'm doing political stories, I'm actually interested to do it. When I tell the story, my friends are like, "Oh, nice, it's very interesting." So that's something people are connected to. So I started liking it, and that's about it. So let's see how it goes.
Look out for Laasya's stories. I think it'll be the first time we have someone based in the South who's going to be bringing us stories for Newslaundry. So I think it's quite exciting. As I did last week. It's titled Multiple 48-Hour Shifts, Risk of COVID. Delhi's doctors are desperate for a system overhaul. So I think in late December, we actually started seeing visuals of doctors protesting. This was one of their primary demands, was that the NEET PG counseling be conducted at the earliest and without any more delays. Could you start by just sort of telling us what are these NEET PG counseling? I actually haven't heard it a lot before this. So if you could explain to us.
Right. So basically, the NEET is the doctors who've completed the MBBS degree and internship that will sit for this national eligibility come entrance test for postgraduate students to study a particular specialization, such as medicine or surgery. Now, the test usually takes place in Jan, but then last year it was delayed till November, and last year. And because of COVID, and then the counseling was also delayed then because the matter was in the Supreme Court regarding this new quota for economically weaker classes. So that was the main issue. But regarding the counseling was delayed. Without counseling, then new doctors would not be able to come into the hospitals. So that was the main issue.
But your story actually goes a little forward because you look at how, and those visuals were actually quite stunning because it was a pretty big protest. And happening at the onset of the third wave. So it was also a little scary to think that, at this point, if doctors go on strike, when we're most dependent on them, and you think that their issues would be addressed with a certain sense of urgency. Did you feel that that happened?
Like you said, my story was more about giving a 360-degree view of all, like, if not all, like most of the issues that plague doctors in Delhi, not just this counseling issue. It went further than that. So, for instance, when they talked to me about these issues that are stacked over the years, it wasn't just like this because COVID, it's like I wrote in the story, COVID made a bad situation worse. So the issues that these doctors have been facing have been going on for very long. They've remained unaddressed. For example, something as basic as the number of the hours that a doctor has to do in a week. So according to guidelines that were set as late as 2008, that says that a doctor has to work 48 hours in a week. But then in the first, second, third wave, and it's become quite a normal thing in Delhi government hospitals, especially, that 48-hour shifts are very common. So stuff like that, and something as basic as, for example, scrubs that a doctor has to wear into the when he goes into the operating theater. So Delhi, the doctors that I spoke to, they told me that they have to buy their own scrubs. The hospital doesn't provide them. So stuff like that, so they have doctor resident rooms where doctors, they can relax and in their after their shifts. Okay, 1 second. Where should I do it from? They had to go out.
You can talk.
Yeah. The doctor resident.
I'll also ask more specific questions about these things. Okay, great. My God.
Yeah.
So I'll ask more specific. So just maybe give a brief, and then we'll go into the details.
Yeah. So, like I said, it was more about providing an overview of the issues that doctors face in Delhi, from overwork, from the number of hours that they work in a week, which is more than 48 in some cases, and to something as basic as getting, the hospital not providing them with scrubs and slippers for the operating theater. So it covered a lot of issues, not just the PG counseling issue.
So the PG counseling issue in that aspect was like a trigger, and things had kind of snowballed over the last 2-3 years.
Yes. Yeah, so I mean, the issue of the skewed doctor-patient ratio has been an issue that's been it's been at the fore for many, many years. Now, COVID, it just, so the doctor at Maulana Azad Medical Hospital said, for a hospital that allocates 50% of its beds to COVID patients, first of all, they're already working at a reduced capacity because of the lack of seats and the less number of doctors in the government hospitals. Then they are further, segregating it into 50% doctors will work for non-COVID patients and 50% will work for COVID patients. And the number of patients is 4 times what it's supposed to be. So if you look at that situation, it's catastrophic, in itself. So,
Is that he says that this is totally catastrophic for health workers, right? Mm-hmm. And is there a reason why you've chosen? So you look at cases in particularly 2 hospitals, Safdarjung and Maulana Azad Hospital, which are both government hospitals, right?
One is, so Safdarjung is a hospital run by the central government, and Maulana is Delhi.
Okay, so can you tell me, one, what is, why you chose these 2 hospitals, and also what is the difference between a central government run hospital and a state government run hospital?
So the reason I chose the 2 hospitals was Safdarjung because it was at the forefront of the NEET PG, protests, and also because both of these hospitals are for example, Safdarjung is one of the largest centrally run government hospitals, and Maulana Azad, in the same way, is one of the largest Delhi government run hospitals, which is why I chose these 2, as the.
in this
as the case studies, yes. And in terms of difference, from what I learned from the doctors, it's essentially funding, right? Like the centrally run hospitals will be funded by the center, and government will be funded by the government. In terms of, if you're asking me in terms of like which was worse, like regarding issues, then I felt like both of them had, like they were at par with each other, like with regard to that. But yeah, other than that, I didn't see any difference.
What about in terms of grievance redressal? Like, did you feel like the central government run hospital, the responses that they got from the government when doctors were reaching out or protesting, was there a difference in that?
So I can say that the Maulana Azad Medical Hospital, so the doctor very categorically told me that, every time there is an issue, they do get it addressed by the medical superintendent or medical director, and they do get a very quick response. Whether the implementation period is still very long, and that is still an issue that's there. For example, in December last year, they had an incident where the father of a patient, he came into the hospital, and there was the heated argument between the doctor and the father, and he just took out his gun and laid it on the table as to intimidate the doctor. And so immediately after that, the doctors, the Resident Doctors Association, they approached the medical superintendent and asked him to, among other things, to install CCTV cameras in the in specific wards that are in specific wards. Now, till today, that was in December, till today, that has not been done. Now, so stuff like it does take time. The matters are addressed, they are given reassurances, but then it takes a long time to implement.
Laasya, any idea how it's in Chennai? Like, is there also an issue of doctors being overworked? Is that also in the headlines quite a bit?
Okay, so I did an article last year about the plight of government doctors in Chennai. They were not paid on time, the PG doctors, and the manpower is short-staffed, and there's also not a lot of equipment in the hospitals. There was a dearth for sanitizers too in the hospitals. So currently the issue remains that there are one thing that I feel is the same is the fact that the doctors are not given enough time for quarantine. I am just like Supriti has mentioned in her article. I'm wondering if it is because the government actually thinks this wave is very mild, or is it because there is a shortage of staff in the hospitals? So I want to ask this question to Supriti. Is it like, what do you feel of like the rule? Actually, only one hospital in Delhi is following the rule, as you have mentioned in the article, the quarantine part. So what do you think about it? Why do you think it's happening?
So, like I said in the article, there's only one hospital that's providing accommodation for quarantine for these doctors. Now, so the medical superintendent or medical director of both of these hospitals, they didn't respond to any queries that I had sent, and the doctors themselves don't know why this this change has happened. Like, we can obviously guess that it's because they are short staffed, obviously, because I mean, they don't have enough staff. They are taking this wave very, are considering this wave to be a very mild one. So these are the reasons, but that doesn't mean that the doctors, that this doesn't weigh heavily on the doctors, because they see the kind of toll that even Omicron takes on patients. It takes a week to recover. It is a very I don't know if any of you tested positive this thing, but it's quite it's quite bad. It's not mild, like as they try to say. So yeah, I think these are the reasons why. But it was a huge it was something that the doctors were really concerned about, because the safety of their families and themselves is something that is a huge burden on them.
So viewers, this is where the video segment of this podcast is going to end. If you want to listen to the rest of the podcast, we are also going to be talking about Laasya's story, which was about young women students in a college in Karnataka who were not allowed to enter their classroom because they were wearing the hijab. That's the story we're going to talk about next. So if you want to listen to the rest of the podcast, head on over to our website, newslaundry.com. We have our own podcast player. You can listen to it on that, or you can, of course, listen to it on Apple, Stitcher, or any other platform where you listen to your podcasts.
The subscription model is something that keeps News Laundry afloat, but we need hundreds and thousands of people to completely transform the news ecosystem. So you pay for news, so it serves you. So click on the link with this video, subscribe to News Laundry and pay to keep news free, और गर्व से कहो मेरे खर्च पर आज़ाद है खबरें.